last but not least, we have our final speaker of today. Unfortunately, Dr. Stefansson couldn't make it, but we found a worthy replacement. Mikolaj Gurdala is Innovation Manager at EIT Health InnoStars, and they will talk about InnoStars and the projects they support in regions. Mikolaj, the floor is yours.
Hi, Jolene, thank you. Just a second, I'm gonna start my presentation. Okay. I hope you can, yeah, you will be able to see it on a full screen. Yes, I hope you can see it. Yes, fantastic. So, yes. Good morning, everybody. Maybe for some of you already sitting with, let's say, 1 hour difference from Poland, where I'm based in, it's already afternoon. So thanks again for, let's say, having this opportunity to present you shortly the EIT Health InnoStars. And I'll try to be brief and tell you a bit more about the things we do across the regions. So EIT Health is a part of EIT Health InnoStars is a part of EIT Health, so one of the knowledge and innovation communities. Currently, we have 9 of these being managed by European Institute of Innovation and Technology, which is a body of European Union. This is an idea that was brought by Commissioner Barroso in beginning of the century to make Europe more competitive in the key sectors where major stakeholders of academia, business, but also research should be brought together. We have converted this into active living and healthy aging domain by establishing a partnership of emerging regions. And as you can see on the map, we have a stable partnership of innovation ecosystems in 4 countries, in Poland, Hungary, Italy, and Portugal. We also have extended partnership, which I will speak about in the next couple of minutes. So we coordinate so-called EIT Health hubs in 12 other countries. Our major activities are considered around, let's say, 3 major business lines, which we call pillars, and they are referring to innovation activities, education, and also business creation. So as you can see, we try to work on, let's say, supporting startups, but also entrepreneurs at the universities, research institutes, but we also strongly work with the payers and providers, and I will try to give you a couple of ideas and examples. What I want to underline is that we are having our headquarters in Budapest, from which we try to manage the operations across these let's say 14 countries. We also try to expose the regions to possible networking, capacity building activities with the members of EIT Health across Europe. We also have our additional subsidiary offices in Silicon Valley and also in Israel, where we try to source out the innovation capacities for innovators, but also regional authorities and startups in the regions where we operate. The consortium consists of various stakeholders, so these are not only universities, but we also strongly work with the medtech, pharma, and ICT industry. We also have CROs. We strongly work with the providers, so we have, as you can see, a couple of clinical hospitals that are, either belong to universities or they're state-owned or they're owned by the regions. And last but not least, we also strongly work with research and technology organizations, clusters, and also patients organizations, as we believe that innovations should be patient-centered, which has been already mentioned by the couple of other speakers during today's webinar. Let's say innovators are in the center together with the patients. So we support only the projects, the teams, the startups that really put the patients in the center. They try to solve concrete clinical and outpatient needs. So as InnoStars, we support, let's say we have supported over 50 startups from different domains, and we have a lot of successful stories when it comes to Central, Eastern, and Southern regions. These startups are not only recognized by providers, by the patients, but they also compete successfully. They gain funding from investors, and they are bringing their solutions very quickly to the market. We have also developed, let's say, a specific scheme in which we try to add the regions which are not part of the European, the knowledge and innovation communities in Europe. We try to create an effective links between these regions that are, let's say, geographically dispersed around the Europe. So as you can see, starting from the Baltics through the Central Eastern Europe until Southern Europe, and we try to give them exposure. And this is not only by individual organizations that you can see on the slide, but we really engage the whole regions, the communities. We work with the policymakers. We try to give these regions access to innovation scaling in healthcare across the Europe. And my last, let's say, slide is really focused on concrete ideas, because I believe that this is a major notion of what we are doing within the EIT Health. So I brought 3 examples that I had a chance to work personally with those teams or with these projects, accelerating them or making them connected to different partners across the Europe, like payers or regulators. And what I want to underline here is that all these have been developed in the regions that we also have in the Sapphire projects, which is Hungary, Portugal, and Poland. And obviously you will have access to the slides, but just want to show you 2 things. So first of all, as you can see, we work in different domains. So some of these projects are connected more to biotech innovations. We also have a strong domain in digital health, but also in medtech, in medical devices. And if you go through all these, let's say, examples, so starting from the first one where we have a large international corporate working with a regional hospital in Szeged in Hungary, you will see that we try to enable and expose the solutions to the patients and practitioners in the region. So we are really trying to bring a top-notch innovations to the patients, regardless the region in which they are located. So through the network, and I believe we're one of the strongest networks when it comes to private and public partnerships in healthcare in Europe, we are able to connect a large corporation with the local hospital. In the second example that we have been supporting a couple of years ago in Portugal, we managed to expose the, let's say, an outpatient rehabilitation services through hospitals in the central region of Portugal, and we have enabled patients but also rehabilitation staff to do the examination, but mainly the rehabilitation process after stroke at home. So as you can see, again, through a technology that has been developed in a research institute, we were able to bring it to the patients relatively quickly. And the last example, which is, let's say, the newest one, based on the, let's say, a COVID pandemic, a startup from Krakow in Poland, so from my home country, together with the Medical University of Łódź, which is one of our partners. They have developed an interactive web-based simulator that enables staff to test and improve their skills on ultrasonography diagnosis. So again, this is a digital health solution, but actually it will be now broadly used by GPs in different also rural areas, first in Poland and then in the other countries. So this is just I would say a short snapshot on what we are doing. Every year we support around, let's say, more than 100 different projects. I just show you a couple of startups, these 3 examples that are implemented in the InnoStars regions. And if you have any questions or you would like to know more about the organization, I'm happy to provide you more information. And thank you very much for your attention.
Thanks a lot, Mikolaj. I have a first question for you. What are the major challenges identified by EIT Health InnoStars in implementing these novel solutions in healthcare in these regions?
Yeah, thank you for that question. So Cynthia, I believe that the first challenge we face is that the regions are very different when it comes to their innovation capacity. So we really try to aim to, let's say, bring these gaps together. So there are regions that have much more, let's say, in common when it comes to joint processes. So for instance, when I look at I gave the example of central region of Portugal. Stakeholders are working very closely. The policymakers, decision makers are engaged in the innovation processes, and then really the personalized medicine approach, but also projects can be very, let's say, fastly brought to the patients. But on the contrary, we have regions that, and let's say we have observed a couple of these that for instance, an access to GPs is low. That some regions are not attractive when it comes to going and working there. The digital skills are relatively low. The legislation or data interoperability is weak because, let's say, European healthcare is very fragmented. We have this privilege, but also the challenge that we look on, let's say, more than 20 countries, which is, let's say, like number of regions, and we see that this is a challenge. The variety of European healthcare, it's also not helping to make the European healthcare economy very competitive because we are different. And we can see that, for instance, a lot of really good projects, they simply escape from Europe and, for instance, they go to US because the legislation, the framework is much easier for innovators to access.
Mm-hmm. And how does EIT Health InnoStars support regions, including the various healthcare stakeholders, in faster and more effective diffusion of innovation in personalized medicine?
Yeah, that's a very good question, because on one hand we have, let's say, limited resources, and obviously seeing the regions with different needs, you would obviously find, well, we should do a tailor-made or customized, let's say, programs or supports for these regions. But what we try to do is actually we have set up a couple of mentoring programs in which we try to simply adjust, let's say, running programs within the EIT Health into the needs of the region. So I can just give one example. If there is a region that, for instance, would like to develop its, clinical leadership maturity level, which means that we would like to bring, more clinical trials to this region, so we would like to expose the patients to more personalized medicine, let's say, therapies, we try to equip clinical staff or industry that is located there, or CROs with the access to knowledge and network, how to make this region more attractive. If this is more on the technology transfer, then we work with the TTOs at the universities. We bring, let's say, startups or acceleration programs from the other countries to that region, and we try to tell them basically how to accumulate and encompass the potential that is hidden in the region. Because in many cases, our work is simply to get together the people that have not been talking to each other for years. So simply, we rather try to be an animator, an enabler and facilitator of people in the region speaking together about personalized medicine, innovation, or how their healthcare systems can work much more effectively.
Mm-hmm. And what would be your tips for other remote, rural, or sparsely populated regions that want to implement such novel solutions?
Yeah, well, probably we do not have too much, let's say, choice here, because when we, let's say, we observed let's say, the pandemics as EIT Health, but let's say just before the pandemics start, we also published a report about the role of artificial intelligence in healthcare. And I believe there are three, let's say, major, I would say, obstacles or challenges that, Europe in general, but I think all the European regions should look at. So the first one is about legislation, and I think Anna just before said that having let's say, unified or at least legislation, and we have, I think, at least 2 webinars in Sapphire about this. I think this is a huge hurdle, and if every region works differently, and especially if you have certain shortages on infrastructure, especially in the rural, let's say, sparsely populated regions, then basically your ability to diffuse or implement certain technologies is getting lower. So the first one is legislation. Second one, I would say, is education. And I think all the speakers today were speaking about the education, not only for the GPs, not only for practitioners, but also for the citizens. And I think this is what we are also trying to do. And when I was speaking about the AI, we are probably thinking about completely new professions, new occupations we will have. A data analyst that will be sitting in a large, let's say, data sets, and they will be just doing, you know, a personalized medicine or on a special profiling for the patients in different regions, even without traveling there or even without seeing the patients. And last but not least, obviously, this is financing. So I think we have to start thinking about much more smarter investments. We should look at the pilots. So we have seen a couple of ideas here today in the Nordic countries, but also in the Southern Europe, in Wales. And I think these are fantastic examples. We also try to work with this micro grants or pilot projects where you do not only test out the technology, but you look at the healthcare innovation in a broader sense. So you're not only looking at if I know a device is mature enough, but whether there is somebody who is willing to pay for this. So if there is any, let's say, regulatory pathway, if there is, let's say, a strong clinical evidence behind this, and I believe Adrian was speaking about this pharmacogenomics here. So I think this is quite important. And last but not least, I mean, if the team or basically people behind this idea, they have enough competences, skills, and I would say, and a push to make it happen. So just in a wrap up, it's about legislation, financing, and education. And I think if all these three things will be working together, the regions, regardless where they are, they have much more chances to implement personalized medicine innovations in their territory.
Yeah, so the ministries of health, education, and economy, innovation, research should all work in the same direction.
Well, exactly. I think this coordination is needed. We also try to engage those ones that it's not about, I mean, even sometimes it's not about, let's say this example, putting more money, but spending the money in a smarter way. So I don't, like, as you said, for ministries, if they coordinate their efforts, they don't have to launch new programs. They can simply just look what they have and just make it more effectively for the citizens and patients.
Yeah. Yeah, and depending on where they are, it depends on the level they are working, actually. But for some, this is in regions, and for some, it's more on the national level. But so
exactly, yeah, we face that very strongly. But I think, let's say, COVID showed that this coordination is needed. But so on one hand, you cannot have only a top-down approach that I know that many countries did, but somehow it was needed. For instance, when it comes to strategic supply of pharma components or personal security, let's say, tools. But there has to be, for instance, when it comes to certain interventions, they have to be done locally. So, for instance, when you're thinking about COVID restrictions, I mean, I strongly support this regional approach, because this is where you have data. You know what is happening, what kind of conditions or obstacles you have in the region, and they might not always be the same at the level of the whole country.
Yeah, thanks a lot, Mikolaj.